No.
Correct.
Okay. And all right, let's call the meeting to order. No public comment. I looked over the minutes and they all seem to be in order. So unless anybody has a correction or deletion, can I have a motion to accept those minutes?
I make a
I'll make a
motion.
motion that we accept.
Second.
I second.
Okay, all in favor? Aye. Anybody
Aye.
opposed? Okay, so the minutes will be accepted. Health inspectors report. Ed had submitted a, is Ed here? I didn't even.
Yep, right here.
Oh, there. Ed is here. How you doing, Ed?
I'm doing
Oh,
good.
you got the Golden Gate. You're out in San Francisco. Yeah.
Oh, yeah, it's been decades, but it's nice to be
For
back.
you, yeah. So you had supplied the tally of the inspections for 2021. Anything notable to add or talk about?
Not really. We've been shut down for a couple weeks now. Pretty much
Oh.
going as it was. Charlie might have
I
more
see you
info.
had. What's that?
I said Charlie might have more info on the meetings. I mean, on the inspections.
Okay.
Yeah, actually, I did the yearly report for you, and I'm here just
Oh,
to see if
okay.
you have any particular questions in regards to any part of it.
I'm just curious, you list 37 animal complaint investigations. What typically does that involve? I'm just curious.
Here now, we're going to jump back to Ed because this is Ed's department. He
Oh,
handles the animal.
okay.
Yeah.
Oh,
Generally,
okay, I got it.
generally their neighbor complaints. Well, I'll get them from the animal control officers. And most of it's for chickens and farm stock animals. But I have one today that came across. The girl has 26 cats.
Ooh,
So it's just a case by case, breakdown.
Yeah, yeah.
As far as the cats and dogs, it's allowed as long as they can prove that they have all their shots and they're well taken care of. Savannah, what's her name? Well, Hayden Carroll, the one officer, he would do an inspection of the properties and he would check for their shot records and whatnot. And then they forwarded to me. So
I mean, and I'm
But-
curious, how does that, if you have a dog that barks 24/7 next to you, I mean, how are those things generally resolved?
well, generally that would be a police issue then because it's a noise violation. That doesn't really
Oh.
concern us. What ours is the drop-ins in the yard and stuff like that, and generally the health of the animals. It's a tough problem because you tell people to get rid of their pets almost,
Yeah,
But as far as
Yeah, right.
now they have to get a zoning permit for farm animals, for a chicken or a rooster. And
Right.
that's like $1,000 just to apply for it. So that's nipping in the butt pretty quick because.
And let me guess, a lot of people have them and haven't applied for it.
Yeah, there's a rooster in the neighborhood now where I live. So. But I mean, and
He'd only have to wake me up one time in the morning.
and they just assume they have, if they're hens, we generally for us to discover them because they don't make noise.
Yeah.
But they all
Right.
think they got to have the rooster so they have their eggs, and they don't, and it's just hard to explain.
Yeah, right.
But the roosters are a problem. Why they have them, I had no idea. I grew up on a farm. I mean, roosters are all right, but I wouldn't consider them
Yeah.
something I'd have in my little tiny yard in the city of Reddit.
yeah. Oh,
Well, okay. We don't have any up near me. Thank God.
Not yet.
Yeah. Operative word is yet, yeah. On the coronavirus update, who's here? Doesn't look like any of the, Michael there is Michael on board here? Is he going to give us an update,
Pretty much, and anybody who's been watching the news knows, thankfully the numbers are starting to come down in this state. However, our ambulance in the city is still transporting a fair amount of COVID patients. We had several members infected despite being vaccinated. There were a couple breakthrough cases of those who did have the booster shot, did have some mild COVID symptoms. Both hospitals actually had a little bit of a period from December and the beginning of this month of being on divert status, which means that they're requesting that we don't come there. But when both hospitals would go on divert, then we would, just pretty much just try to spread the wealth around, so to speak. There have been several meetings between myself, Western Berks, and a few of the other ambulance services, and as well as the hospitals, to try to alleviate some of this and the workflow and all. But nothing yet has really come of that. And thankfully, we haven't had any of the hospitals go on divert recently within the last, I'd say, week or two.
And are you doing okay from the standpoint of availability of protective gear? And do you
Yes.
guys have availability to get test kits and that sort of thing to test your people?
The
or
test
how
kits,
you doing?
the test kits are a little, I don't want to say problematic, because at one point we considered doing weekly testing again, because at one point, December of 2020 into 2021, for like about 4 or 5 months, we were weekly testing our staff just to make sure that everybody was, no one was an asymptomatic carrier. And that was all well and good. But now, with tests being a little bit harder to come by, and, as well as staff, that was becoming a little bit problematic. I tried to get our CLIA form amended, and that became a whole bunch of fun, because, you could do your COVID test at home. You can get this, a free test from the government, but yet to do that same test, I would have to have, for our laboratories permit, and all, I'd have to have a physician listed as the lab director, and so on and so forth, and jump through a lot of hoops. So that's the only real thing. I mean, but when it comes to N95, sanitizer, PPE of all sorts, I have a room full of it. So
good.
The fire marshal emergency management has taken really good care of us with that.
Good. Perhaps could we pivot to you, Dr. Kelleher? Could you give us an update? You're on the front lines. Can you give us your perspective on what you're seeing and what you hear from the hospitals?
Yep. We were, and I also serve on the community COVID task force. So we talk with Brian from the emergency management and both the leaders at the hospital. So the cases definitely went through a significant surge that was leading to a lot more people infected. Not as many severe infections, but the hospital was still seeing, just to the point that was just made, a significant increase of the hospitalizations and ICU admissions, which has since gone down. I'm going to share the publicly available dashboard for Reading Hospital, because I always look at that. And when you look at it, Reading Hospital is the RH here. And so you can see that this is updated as of today. There are 13 patients in the ICU, 4 vaccinated, 9 are unvaccinated. Inpatients is still up to 97 within the whole health system is 186. 67 unvaccinated, 30 vaccinated. What's not clear is they do not count boosters. We're seeing anecdotally in the hospital also reported that people who have received their booster are less likely to end up in the hospital and end up sickest in the hospital. It does not seem like the 2 vaccines are enough to really prevent infection with Omicron. They're better at preventing severe infection, but not really as great in preventing infection. So you are seeing more vaccinated people in the hospital, but at a smaller percentage than the unvaccinated. Looking similarly at the sickest of the sick, ventilated, total health system of Tower Health is 15, 12 being unvaccinated, 3 being vaccinated. And again, on this public facing dashboard, they don't tell you about the status of these patients, what comorbidities they have, what immunocompromising conditions they have. But looking at the big picture, we do know that the vaccinated patients who end up sick often have 4+ comorbidities and are the sicker patient population to begin with. So it's not done. I think people are getting sick of it and feeling it's done, but it's not. And then on the workforce, we had our biggest percentage of our workforce be out with COVID that has happened since the pandemic began. So we were seeing, cases of infection amongst our work staff the highest it's ever been. It's just proving to the increased effectiveness of the Omicron. Just more and more people being infected. We're starting to cause us to have some work staff issues. It's gone down. So far this week was not too bad. But 2 weeks ago, I couldn't believe how many people were getting infected and having to be off work. And Deb Powell looked at me with not too much sympathetic eyes because she's been seeing that for months already. But it was the first time we on the outpatient side had seen it. That's something that she's been dealing with from the beginning. But it does look like the boosters do protect you. And 2 vaccines, not as good a job as having received your booster.
I have a couple of questions. It seems everywhere you read that you definitely want to get the booster because that helps quite a bit. I, for good or for bad, was like, got the booster the first day they were available. So now I'm like 14 weeks post booster. Does anybody have any sense of how quickly the booster protection is going to wear off? Have you
Yeah,
read anything or know anything about that?
We always kind of follow countries that are ahead of us. So there are countries that are ahead of us of the surge, who had the surge and saw the downward cases, who've been boosting their patients and have had the downward surge. There are some places in Europe who are talking about a 4th shot. We're not there yet, but they don't know. But they do give statistics that up until at least 6 months, it looks pretty good in protecting. But past that 6 months, I think it's still undetermined what's going to happen. But they do believe that the booster protects you for additional at least 6 months. But I think there's a big unknown if that's going to be playing itself out. And the big fear is, what if another variant comes through? Will it break through the vaccine even more so than the Omicron? And you really hope that you don't have an increased contagious virus like Omicron with an increased severity like Delta. That would be the variant that would turn everything upside down. So that's what everyone's hoping does not occur.
I don't know whether you can answer this. I have a question about how they report in the hospital, because I was listening to somebody talking who was somewhat critical of the way at least some hospitals report what they were claiming. They gave an example of a hospital who reported 50 inpatients with COVID. But they said if you broke that down, probably only a little over half were actually in the hospital because of COVID, and that some of the other people were there asymptomatic. Maybe they were there having a baby or having a hernia fixed. And just by broad testing, they uncovered the fact that they were positive. And then therefore they got thrown in the mix as though they, people would look at the numbers and think they were actually in the hospital sick with COVID. Do you have any idea how we calculate the numbers?
Yep, I think there's definitely truth to that with this new Omicron, that there are more incidental findings of COVID with hospital admissions. So with Delta, most of the people in the hospital with COVID were there because they were having respiratory distress. And with the increased contagiousness of Omicron, you were having more people go in for other reasons, but because the prevalence of Omicron is so much more, they were being tested positive. So then you look at really what really counts is the severity of the people in the ICU, on ventilators, that sickest part. And it's coming down, but there was an increasing death rate, an increasing trend of those severely ill. So we were still seeing severe illness amongst a bigger denominator. So the denominator people with COVID was still big,
Sure.
But the percentage of that bigger denominator. So even if the percentage is small,
Right.
When your denominator is so much bigger, you're going to have more people of the sickest, because really nobody wants COVID, but really what nobody wants to do is end up in the ICU on a ventilator. So the more that denominator grows, the more likely, even if it's a small percentage, the sickest people will also grow with it.
And another question, where does Berks County stand, as far as having availability of options for treating the disease, not preventing it, but the things like the monoclonal antibodies and some of these drugs now that are supposed to show such great promise. Are any of those around for anybody to actually use in Berks County?
That we used to have pretty good access to the monoclonal antibody therapy, and then it turned out that it was not very effective against Omicron, so they pretty much stopped distributing it. So there was only one monoclonal antibody therapy that was effective and was very, very, very limited. So there was not a lot of access to it. I think there has been some access to it now. So there are some, and I'm forgetting the the generic name of the medication, but it's like 40 doses. So we might have been giving 40 of the traditional monoclonal antibodies a day. And now we have 40 of the newer treatments sensitive to Omicron for the whole patient population. There's also some oral medications that are on the horizon for treatment. And those are not widely available as of yet. So it's still the sickest of patients have less access to some of those therapeutics. There's another medication that Dr. Powell is referring to that UPMC in the western side of the state had access to, and they had 12,000 people who were labeled as immunocompromised who would have been candidates for it, and they got 400 doses. So they were doing a lottery system of who would be eligible. Those are the sickest of the sickest, the people on active cancer treatments, transplant patients. So UPMC, who had access to this new medication, had 400 doses for a population of eligibility of 12,000 patients.
Yeah, because some of those drugs, if they truly had the promise they've been touted, that could, everybody keeps saying it could be a game changer. I guess we got to have them in our possession to work.
Yeah. We as the FQHC there were some FQHCs who had access to some of the oral antivirals. We were not chosen from the state as one of them. They were pretty much like Philadelphia, Pittsburgh, the big urban areas with the high numbers. But we have signed up to become eligible, so we could get access just to bring whatever therapeutics we can. We have signed up to be considered to become eligible to receive some of those medications in the future.
All righty. Well, thank you. That was very informative. Anybody have any other questions regarding the COVID? You think how long is it going to take until nothing about coronavirus shows up on our agenda?
We can dream, can't we?
I don't know. All right. Let's move on into old business. Michelle, anything to report on Berks Teens Matters update? They decide on that new name yet?
They have not yet decided on a name, and they have not held a meeting. Our next meeting is not until February.
But there's still some stuff going on at the high school, as far as you know, as far as services provided.
As far as I know, yes. So there's been some turnover with staff at BTM, so I'm not sure exactly who's there anymore, but I understand it's still operational.
Okay. All right. Yeah, I can see everything slowing down. Let me see. Jamal's not here today, or is he? No, I don't see him. Anybody have anything to add on the lead abatement program? It sounded like when Jamal gave his report last time, they have to do a lot of training of people to get in place to provide the services. Anybody have any update on that they'd want to provide? Do you have anything?
I know the other
Dr. Keller?
inspectors were doing training. I don't know how far along it was going, but they moved out of the office, so I think they're training at home now. So it's still ongoing with the training for the inspectors.
Okay.
Excuse me, John, this is Rudy Estrada.
Oh, hi. Hi, Rudy.
I just wanted to add a little more information to what Ed Blackenbiller. I'm sorry if I have a little background noise behind me. I apologize for that. But
You're coming through fine.
In terms of the additional information to the LED program, what I would like to do is I have one of our inspectors which following through an entire program beside Jamal. His name is Jeff Young, and pretty much for our next meeting, I'm gonna make sure that he's available to join us, so he can provide some additional information. But in general, the program is rolling. As far as I know, I'm not getting involved much in it because obviously I have all the duties to take care of it. But the program is rolling, and he's managing, as of today, he's managing all that. And I believe last month, we have, beside Jeff Young, we have two other inspectors attending to a week training, in terms of the LED program and everything that's related to that to obtain the state and the federal certification to continue that program.
All righty, thank you. Anybody have anything? Typically, Jamal brings us up to date on the eviction moratorium and what's going on there. Anybody have any information on that you need to share?
Yeah, and unfortunately, I don't have anything related to that.
Okay. And then the county health department, is anything happening that you're aware of? Dr. Kelleher, I know you've been involved with that.
And not that I'm aware of. I know that they were hiring a consultant to look at it, but I don't know if they've made any kind of conclusions or any motion on that.
Okay. All righty. Is there any other new business that anybody would like to bring up?
Mm,
All right. Somehow we're gonna think we'll ever, I'm not sure, even if COVID completely disappeared tomorrow, this Zoom is pretty convenient for everybody. I think we have more people attending the meeting now because it's, I mean, especially if you're a city worker and you're in some office and running around, I mean, it's tough to get into City Hall. And so maybe we'll have to have a big party when it's over. All get together. I'll sponsor it. How's that? And we can all get together
Sounds like a
inside.
plan.
a big party. And I'll sponsor the party. Am I allowed to do that? Or is that, I know there's like all sorts of strict rules on what you can, well, Michelle will pave the way for that.
I'll search that, but I'm pretty sure that
You research
one
that. So,
time
a big
food
party-
drink does
big
not
party, yeah,
count.
big
So
party
I'll,
somewhere. Yeah, we really should do that, seriously. Oh, well, hopefully better days are coming. And then there are some outstanding, that are on the back burner, the health code amendment and the amendments to the health board. So unless anybody else has any agenda items, I guess we could close the meeting. I have a motion for adjournment.
I
Make a
motion to
motion that we
adjourn.
adjourn.
You want to stay here all afternoon? Okay, all in favor? All right, well then, I guess the next meeting would be the usual time. That's actually one of my daughter's birthdays, but it's very unlikely that I would be visiting her on that birthday, so I should be around. And if I were, I'll just zoom in from her place.
That's April 5th.
Yeah, we moved this meeting because I was supposed to go away later this week to go to Florida, and now my wife announced she doesn't want to go, so I'm either going to go alone or cancel. I'm not sure what. Anybody want to go to Florida? Anybody want to go to Florida for a week? Anybody wants to go to Florida for a week? Let me know.
Say hello to Mickey while you're down there.
I don't want to see Mickey. All righty. Thanks. See you all later.
Thank you. Be
Have a
safe.
good week.
Thank you for attending. Bye-bye. Yes, stay away from those COVID bugs.
Oh, absolutely.